911, what is your emergency?
Yeah, I'm at Woodlands Crafters, store 809 here, Carrollwood. I have one of my coworkers having hard chest pains. Just try to take these breaths.
We got called for a 50-year-old male chest pain at Lynn's Crafters.
That's when I saw that, okay, this guy's having a big one. Let's go. Let's get things done. We have numerous things we have to do, and we have to get him there as soon as possible.
We get requested for Florida Hospital Tampa all the time, and that was one of the first things that he made sure we knew. I want to go to Florida Hospital Tampa.
They have a great cardiac unit, and if one of my loved ones were in his situation, I would want to take them there.
We did a 12-lead EKG. We noticed that he had a massive STEMI alert, and actually he was the widowmaker.
When a patient like Johnny comes in with chest pain, we all work together as a team to get the patient back, do EKGs, put in lines and labs, put the patient on the monitor. The doctor is giving us orders, and at the same time, the patient's really scared, so we're trying to get our job done quickly and efficiently to get that patient up to the cath lab as soon as possible.
Johnny rolls in the door. We get him on our cath lab table immediately, get all the emergency monitors hooked up to him. We go straight to prepping the access area. We got Johnny draped.
That common description of the widowmaker is a bad sign. Obviously, it's an artery that's so important that when it closes, there's much more damage, much more complications associated with that.
Seconds count because when you lose that blood flow to the artery, your cells in that heart muscle are not getting the oxygen they need to survive.
Quickest way to get artery flow again is the best option. So we treat that with a thing called angioplasty or stenting.
The stent is on a balloon. Dr. Smith was able to inflate that balloon in Johnny's vessel, which opens up that stent, and then very quickly, when that balloon comes down and out, that stent stays behind and that opens that artery and saved the heart muscle for Johnny.
It was like a weight was lifted off of my chest. It's just, I breathed, and I mean, I felt incredible. It was the best feeling of my life.
I think at Florida Hospital Pep and Heart Center, one of the things that we have to offer people is not only our expertise. What you're asking is, where's the heart? The heart of those people that are running with the patient on the gurney, that are expending themselves maybe more than they have to. People sense that. Having been here, I'm a recipient of that. My own family members have been patients right here. If you boil it down, ultimately you're talking about love. When people get loved, they know it. And if people aren't loved, they also know it. So the expression basically of the ministry of Pep and Heart Center is to express love to people with our technology and with our care. That's really what we want to do every day, for every patient, every time.
The most humbling thing about it is nobody wants to take credit for saving my life. Because, I mean, they probably see this every day, and they don't really see the impact, the actual impact of what they do when they save a life. Just a week after I was able to see my daughter graduate, 2 months later, I find out I'm going to be a grandfather for the first time. And these are things you can't get back. And they need to know what they do. It's not just a job. They're creating more memories for people. I want everybody that took part in saving my life, every holiday, every family gathering, every moment I cherish, is all because of you. And I want you to know that from the bottom of my heart.